Hello, everyone. This is Mr. Simone, and I'm here to give you a very brief history of healthcare and health insurance reform in the United States. This will help us as we get ready for a double period lesson on the current healthcare debate in our country. So, we're going to go back to 1912. Those of you might remember that this presidential election pitted the Democrat Woodrow Wilson versus the Republican William Howard Taft. And then there was the former president Theodore Roosevelt running as a bull moose candidate. And then some of your favorite candidate, Eugene V. Debs, the socialist, ran as well. But this is the first time a presidential candidate actually called for universal health insurance for the entire country. It was Teddy Roosevelt who did this in 1912. And then we will go to 1929, and in this year, Baylor University provided a health insurance plan for teachers in Dallas. They had to pay 50 cents a month, and that would give them 21 days of hospital care. And this is the first time that a large-scale health insurance plan took place in the country. We go to 1935, we just finished learning about the New Deal, and you'll notice I said nothing about health insurance. That is because FDR, who did consider it, decided to go with Social Security instead. So still no effort on health insurance on a large scale for the country. Then we go to 1945, and that's a picture of President Harry Truman, who did ask Congress to create a voluntary health insurance plan. It would not be one that would be required, but if you were willing to pay a fee, you could get covered through this plan. It was rejected. Congress did not pass it, and one of the reasons is because the American Medical Association actually lobbied against it. We then move to the 1960s, and Lyndon B Johnson, one of our more liberal Democratic presidents, did convince Congress to pass two plans, Medicare and Medicaid. Medicare is health insurance for the elderly who can begin on that plan at the age of 62, and Medicaid is for people who are below the poverty line. Both of these health insurance programs are still in effect today. Now we go to 1973, and Richard Nixon signed the Health Maintenance Act of 1973. This led to our first large-scale HMO, Health Maintenance Organization. And as you can see in this YouTube clip right here, this is where health insurance companies now start to form for a profit. And this is one of the key sticking points that we have in the healthcare debate today. In 1976, Jimmy Carter made an effort to, don't like when I have typos there, decided to make an effort to get national health care, but the economy was very weak in the 1970s, and this clearly stymied any effort he could have made on this agenda. We then go to Ronald Reagan. This is something that some of your parents might be familiar with. It's called Cobra. So if you do get your health insurance through your job and you happen to leave your job, or sadly if you lose your job, Cobra allows you to stay on your health insurance plan for an additional 18 months. This, of course, you have to pay monthly fees for it, but it definitely helps people during a transition from one job to another. I think that's one of the more impressive parts of our system. And then we go to the 1990s. Bill Clinton put his wife, Hillary, in charge of health care to try to reform the system. She did not get any large-scale effort passed through Congress. However, one thing that it's been debated what level of impact she had on this, but it's called the State Children's Health Insurance Program. And what this does is it provides children with health care. Obviously, if they're covered under Medicaid, they don't have to worry about it. But what if the family is not poor enough to cover for Medicaid, but is still not covered with insurance? Those children are covered under what's called SCHIP, the State Children's Health Insurance Plan. And I have to sadly tell you that this recently has run out of money, and now Congress is in the middle of debating whether or not they will continue to fund this. So there are 9 million children in the country who potentially will be without health insurance in the near future. So I kept this brief and basically covered for you everything up until the current debate, which is where we will take off in class today. I hope everybody enjoyed this. Have a great time, and I will see you in class tomorrow.